Hi, I'm Dr. Lorraine Hill at Hampton Clinic in Solihull. I'd like to talk to you about what treatments we can offer you if you have acne. I usually suggest that you come and have a complimentary skincare consultation with myself so we can talk through any significant past medical history and any medication. Some medication can be making your skin complexion worse, whereas some tablets can actually really help make significant improvements. We need to consider your diet because some foods can definitely make your skin worse, and many foods and supplements can contribute to making your skin much healthier. I'd like to do an overview of the treatment options that we have in clinic before we go on to a more detailed skincare regime using the ZO Skin Health that you will do at home. So for our in-house treatments, we can start with a really intense facial known as the hydrofacial. This has 6 steps to really deeply cleanse your skin, to give it a very deep exfoliation and hydrate it with really good serums that will nourish your skin. And we can end with LED light therapy, where the blue lights will kill any surface bacteria. Moving on from hydrofacial, we can do skin needling. Skin needling's been an age-old technique for improving skin texture and acne scarring. By causing little traumas in the skin with the tiny needles, we call them micro traumas, the body wants to repair those by making collagen and elastin, so it will over time gradually improve your texture. We have more advanced treatments than this now, using something called Tixel, following the similar principles to skin needling by creating micro traumas. It's combined with heat using a hot titanium plate. The combination of the needle injury and the heat will further stimulate collagen, elastin and hyaluronic acid to improve the texture of your skin. Even more advanced machines, we have something called Fractora from the InMode multi-platform device. This again using the micro needling principle. The micro needling has radio frequency heat energy applied through the needles, and again the combination of heat and the micro traumas from the needles is going to promote collagen, elastin, hyaluronic acid and repair of texturally damaged skin. We can add into any of these treatments additional light therapy using the LED light treatment. Blue lights will help kill your surface bacteria, but will also promote collagen and elastin synthesis. So it's very therapeutic treatment on its own. We can then move on to skin peels. Once we've got you on a really good ZO skincare regime at home, we can then move you on to some deeper skin peels. By removing the surface layers of your damaged skin, we can improve your complexion by taking your skin down to baby new skin, much deeper down. We also like to talk about skin supplements. We use a very high quality premium brand of skin supplements known as Zenni. Things such as having a zinc deficiency can actually lead on to acne. So we might need to add in zinc supplements to your diet. Adding in additional vitamin B3 can reduce oil production, which is a big contributing factor to acne. Omega-3s that are normally found in your oily fish and flaxseed oils, they again are also really anti-inflammatory, which you might not be getting enough of in your diet. There's certain supplements within the Zenni skincare range that are very specific to acne, which will contain all of these products and really help improve your skin. So we can feed your skin from within, but we can also feed your skin from the surface. This leads us on to talking about home skincare regime. We like to use the ZO Skin Health skincare. It's a medical brand of skincare, so it's far more effective and far more powerful than anything you will buy over the counter. It's regulated by the MHRA, which is the Medicines Health Regulatory Authority, and this means it's by law allowed to penetrate in the skin and work on a deep cellular level, so it's very powerful and very effective. There's many products within the ZO skincare range that we can offer for acne. But we always start off with the basics and then start adding in more products depending on the severity of your problems. So for the very basics, for anyone from the age of 10 and upwards getting their very first spot, we recommend what we call the getting the skin ready. This includes washing your face, scrubbing your face, and then doing what we call oil control. So this is our range for the getting the skin ready, and we have different products of different strengths according to your particular skin type and skin needs. Generally, for anyone with acne, they're going to have an oily skin, even though it might be a bit sensitized from having used wrong products over the years. So generally we will start with what we call exfoliating cleanser. So with our exfoliating cleanser, we're going to take a pea-sized blob of cleanser and using lukewarm water wash our face for 60 seconds. It's really important not to use hot water because heat will stimulate the oil glands, which will make your acne problem worse. So I generally recommend avoiding hot baths, really hot water from a shower blasting onto your face, saunas and steam rooms. So after 60 seconds of washing with your cleanser and rinsing it off, whilst your face is still wet, we then recommend going on to scrubbing. When we first start you on the skincare range, we might start you off on a more gentle scrub and gradually build you up to stronger scrubs. So we have a choice of 2 scrubs. So we might start you off on the exfoliating polish, which is a blue grainy polish of magnesium oxide crystals that we just rub all over the face for 45 seconds and again rinsing off with lukewarm water. If you've already been on the products for a while or you've got very strong tough skin, we could just put you straight onto the dual action scrub. A pea-sized blob of this, again 45 seconds, and it's going to give your skin a lovely fresh glowing feel immediately after you've washed your face. After we've washed and rinsed it off, we're going to just pat dry with a towel. The dual action scrub has not only the physical grains to physically remove dead skin cells, but it also contains salicylic acid to help dissolve the surface skin cells to remove the dead cells from the surface, which would be blocking your pores and trapping oils, which is making your skin spots worse. So after we've washed and scrubbed and patted our face dry, we'll then move on to the oil control phase. So for this phase, if you've got a very sensitized skin, you've been using the wrong products and it's caused a sensitization to your skin, we might just start with a toner. Alternatively to that, we have 2 different strengths of oil pads. Complexion renewal pads, which are slightly more gentle, going up to stronger pads known as oil control pads. The pad is going to remove the excess oils and just cleanse the skin, giving it a really lovely fresh feeling. So this step is for everybody, and so often that is enough. So for people with very minor problems or you're very young, those 3 steps are enough to get your skin under control. If you have worse problems than that, then we can move on to a number of other steps. Stepping up our skincare regime from getting the skin ready, we would move on to Daily Power Defense. This is a really powerful antioxidant cream. It contains hydrating factors to replenish any lost moisture from the skin. It contains antioxidants, vitamin A, vitamin C, vitamin E. Antioxidants are environmental pollution free radicals that attach to our skin and damage our skin, cause further inflammation and worsening our acne problems. So this Daily Power Defense is going to give us extra protection from all the environmental damage that we're exposed to, as well as sunlight damage. It promotes DNA repair. It stabilizes our epidermis and it gives us a much stronger epidermal skin barrier. After our Daily Power Defense, we might add in Exfoliating Accelerator. Part of the problem of acne is the buildup of dead skin cells, blocking our pores, trapping our oils. So an exfoliating accelerator is going to, it contains a strong glycolic acid, so it's going to break the bonds between all your epithelial cells so they all let go of each other and they all come away much more readily. This allows better penetration of your other skin products, but also is anti-inflammatory, so helps to reduce any inflammation that you have from spots, and it helps to dry up the oils. As an alternative to this, we often alternate either the exfoliating accelerator or benzoyl peroxide. And benzoyl peroxide is a very useful agent for killing off all the surface bacteria that combines with the oils that's trapped in our pores that goes on to cause acne. Both exfoliating accelerator and your acne control, benzoyl peroxide, can both be slightly irritating. It can make your skin a little bit red, dry, peely. So we often won't do both at the same time. We might do 1 month with one and then 1 month with the other. Or we might just use the acne control benzoyl peroxide. We might just use it on individual spots. After that, we can possibly add in, this is our concealer stick, which contains salicylic acid. Salicylic acid is a very useful anti-inflammatory, and if you've got it in the form of a concealer stick that's on your skin all day, you know you've got some active product that's continuing to work throughout the day, giving you really good coverage. So after using all of these products in the morning, we will always need to put on an SPF. Some of the products are going to make us more sensitive to sunlight, and sunlight is aging our skin and possibly causing more inflammation and more oil production. So we're going to have additional protection from our SPF, and we have very good SPFs that are suitable for oily and acne prone skin. In the evening, we can use a couple of other different products. So we'd usually start our evening in the same way. We're getting the skin ready. We'd use the cleanser. We tend to not scrub more than once a day, but we would use the oil control pads again. After that, we like to use a retinol cream. Now, retinol is vitamin A. If you have very severe acne, I would recommend, or a dermatologist is going to recommend, that you might consider oral vitamin A, which is known as Roaccutane. Roaccutane is a very powerful drug for curing acne. This in a cream form is known as retinol. So retinol is a very powerful anti-acne cream treatment, as well as also being known for a very good anti-aging cream. We can combine our retinol with lightening products. So if you've got some pigment issues, we call it post-inflammatory hyperpigmentation, where you've had a big juicy spot and it's left a purplish mark underneath, the lightening products can help fade out these pigment marks. So retinol would be an evening cream that we would use every night with somebody with quite severe acne. And then in addition to this, there's also something called sulfur mask. Sulfur mask can be used in a number of ways. In the initial treatment, we might recommend that you put on a mask for 2 hours every night for a couple of weeks to really help get your oil under control. So sulfur is helping to dry up your oils. It's also anti-inflammatory and it's antibacterial. Once things are under control, we might suggest that you just use your sulfur mask 2 or 3 times a week for 20 minutes. Or alternatively to that, you can put a nice big blue blob on overnight and just leave it soaking on a juicy spot overnight. And you will really find that it helps to dry that spot up and reduce the inflammation. Some of these creams can be drying. It can cause redness, dryness, peeling and a little bit of irritation, but this very soon settles as your skin gets stronger and more tolerant to all of the products. There's no quick fix for acne, but there's so much we can do to help improve it and even cure it in so many cases. It's a journey of restoration, and we suggest that you come and have a chat and just start that journey of getting your skin better. Thank you.